Brazilian butt lift, also known as BBL. Ladies, why are you doing it and for what purpose? And I heard men are doing it too? Seriously? Brazilian butt lifting men? Here is a fact. BBL has the highest death rate compared to any other cosmetic procedure worldwide, with a mortality rate of about 1 in 4,000. So BBL involves removal of fat from parts of your body such as your abdomen, your lower back, thighs, hips, using the liposuction procedure, which involves sucking small amounts of fat through a tube. The extracted fat is then purified, which involves separating the blood and all the other body fluids. And then the purified fat is then injected into the buttocks. Prior to this procedure, you would usually have had a consultation with the plastic surgeon, and I quote plastic surgeon, because ladies or men, you have to check who you're consulting with. Are they reputable, certified? Do they have the necessary qualifications? Do they have the experience with liposuction or fat transfer? Check their success records. Look at before or after pictures, and to ensure that you are not another guinea pig or a victim. So then you have the consultation with the surgeon, then you discuss what you like in terms of shape, size, contour. So some ladies might bring a picture of Kim Kardashian or Nicki Minaj, but bearing in mind that their butts are obviously not real. But you know, back in the days, women used to complain that their butt is too fat, that they like it small or even flat. But nowadays, it's the opposite. Women want big butt. And there are some extremes where the size of the butt is disproportionate to the waist and the legs. I mean, you have toothpick legs and you have a fat butt. That don't make any sense. But there are slightly more sensible women that want a more rounded shape of butt, more lifted, less saggy, and bigger. Now, a lot of reasons why women get BBL is due to maybe lack of confidence about their body shape, not being happy with the way their clothes fit, being made ashamed of or mocked by society. I mean, you see some celebrity websites where basically women are being mocked for the shape of their butt. Or maybe you want to follow the latest trend, such as your Kim Kardashians. Or you might be after a particular line of work that, let's say, pays relatively very well, which is not office work, if you know what I mean. But let's not get into that. Now, we have been brainwashed by society, the media, and images that we see on social media like your Insta and your TikTok, that yeah, if you have a big butt, you're going to be the desire of men, you get job opportunities, offers maybe like going on OnlyFans, or whatever is your ambition. But surely, real men don't want to have a woman who is being ogled or looked at by other men? Surely not. Because there is only one thing on their mind, and then as a woman, you become a sexual object or an object of sexual gratification, which can even lead to the extreme of your life being in danger or being stalked. Now, most women have their BBLs done in cheaper countries like Turkey, Mexico, Poland, Finland, Hungary, because in countries like the UK and the USA, it would cost you an arm and a leg. Now, I wouldn't go into specific prices, but let's say in the UK, it can cost you anything between £6,000 to £12,000. And in the pounds equivalent of the USA, it can cost you again between £6,000 to £18,000. But whereas in Turkey, it can cost you between £2,000 to £5,000. But the mistake here is going for cheap rather than reputable, because it could cost you far more than the £3,000 that you paid when things go pear-shaped. Get it? Pear-shaped? Okay, moving on. You know, in the early days, women used to have BBL surgeries in secret, but now they're more open about it, getting hundreds of thousands and millions of views by posting their journeys from the airport to the plane to the theatre and back home, where they have to lie on their front for at least 1 to 2 months before they're allowed to sit in the butt again. Look, BBL surgeries are on the rise. It has gone from a couple of thousand procedures a year to hundreds of thousands of procedures a year in the space of 5 years. And it has been popularised, obviously, by your favourite female celebrities. BBL is like any other type of surgery in terms of risks. First of all, you have to look at your health profile. What is your BMI, which is your height to weight ratio? Because if your BMI is over 30, then you are classed as obese, which means that you're at increased risk of complications during and after surgery. Then we look at what health conditions do you have. Is there a condition that can affect your breathing, such as asthma? Are you a smoker? Do you have a pre-existing heart condition? Are you diabetic? Do you have high blood pressure? Do you have cholesterol? Is there any family history of blood clots? These are all factors that can increase your risk and lead to blood clots, heart attacks, and strokes during the surgery. And this is why it is important to seek out a reputable surgeon, because a good surgeon will look at your risk profile and actually decide that maybe the risk is far too great for you to undergo the procedure. Whereas a surgeon who is just after your hard cash will say, let's go for it. Now, the immediate risk of BBL surgery include your maybe a possible allergic reaction to the anaesthetic, infection, bleeding, numbness, skin discoloration, bruising, swelling, and you expect some of these side effects to subside within days or weeks. Now with bleeding, if the surgeon for some reason or inadvertently hit your internal organs such as your liver or your bowel, this can lead to laceration and you have bleeding in your internal organs, or nick one of your blood vessels such as an artery, you could potentially bleed to death during the surgery. Another risk is when the fat goes into your blood vessels, called fat embolisation. So if the fat goes into the blood vessels of the lungs, you get a blood clot called pulmonary embolism. And depending on the size of the blood clot, this can usually be fatal. With infection, you can get a serious skin infection such as cellulitis or skin abscesses, which can also spread to the bloodstream, and if not treated promptly with strong antibiotics can lead to sepsis and even death. You can also have recurring infections where you keep having these skin abscesses or cysts that get infected and you keep on requiring repeated antibiotics where there simply seems to be no cure. Now, the injected fat can also die off, known as fat necrosis. So you get hard lumps in your butt, you get oily cysts, you get your contour deformity. I mean, you have seen those celebrities who've had BBL and it looks like the right buttocks looks different from the left buttocks. In a lot of cases with the fat injection, 50% of the injected fats do not survive. Then that means going to the operating table again to have another procedure done. It is usually advised to inject the fat into the tissue under the skin, known as the subcutaneous layer, rather than deep into the muscle, because this is where you have your important structures such as your nerves and your blood vessels, and this reduces the complications such as death. Other risks to consider are hypertrophic scarring, permanent numbness of the area, and if in the future you do decide to lose weight, you could also lose some of the fat volume in your butt, which means again having to go for another procedure. Now, I would not encourage anyone to go for a BBL, but you have to ask yourself, is this something that you absolutely have to do? And if so, again, as I said, look for a surgeon that is a board certified plastic surgeon, practicing for at least 5 years. Check the reviews, maybe speak to people who have had the procedure with that same surgeon if possible. Check that they have an aftercare plan should things go wrong. And while online pictures such as before after pictures can be quite deceptive, you might have to travel out, meet the surgeon in person, meet the staff, check the center or the facility is accredited, and just by meeting them in person and checking the area out, you can actually get a feel of the place, which gives you either good or bad vibes that this is not for you, and even take someone with you or a health professional that knows more about the procedure than you do, as they can also give you feedback and their opinion. And importantly, do not always go for the cheapest price, because you ultimately get what you pay for. Now, unlike silicone implants, which is another dangerous procedure compared to fat transfer, BBL gives you a more natural aesthetic look, and the procedure can last for 10 years or even more if you can manage to keep a steady, healthy weight and stay generally healthy. Okay, if you stayed to the end, here is a trivia question. Which country has the highest death rate of BBL? Please drop some comments below.